Welcome back to Vet NeuroJar, your go-to podcast for the latest and greatest in veterinary neurology and oncology. I'm your host, and today we're embarking on a deep dive into a fascinating and crucial area of canine brain tumor treatment. We're going to unpack a recent study that sheds light on how we can better manage and mitigate the toxic side effects associated with stereotactic radiation therapy, or SRT, when treating those pesky intracranial meningiomas in our beloved canine companions. Now, as many of you know, canine intracranial meningiomas are tumors that develop within the brain. These tumors can cause a range of neurological problems, impacting a dog's quality of life and overall well-being. The good news is that we have several treatment options available, and one of the most promising is external beam radiation therapy. External beam radiation therapy has proven to be more effective than simply providing palliative care, which typically involves managing symptoms with medications like anti-seizure drugs and corticosteroids. Studies have shown that dogs treated with radiation therapy tend to have significantly longer survival times, often ranging from about 1.5 to 2.5 years. This is in stark contrast to the outcomes of dogs receiving palliative care alone, where survival times are often limited to just a couple of months. Veterinarians can use radiation therapy in a number of ways. It can be the primary treatment, aiming to eradicate the tumor directly. Or it can be used as an adjunct to surgery, targeting any microscopic residual disease that may remain after the bulk of the tumor has been removed.
Now, let's talk about the traditional approach to radiation therapy, which is known as finely fractionated radiation therapy, or FRT. In this method, the total required dose of radiation is divided into multiple smaller sessions, called fractions. The rationale behind this approach is to minimize damage to the healthy brain tissue and nerves that surround the tumor. By delivering the radiation in small, carefully calibrated doses, we can spare the normal brain tissue from the brunt of the radiation's effects. However, in cases where there is a clearly defined tumor that we can precisely target, another option comes into play: stereotactic radiation therapy, or SRT. SRT represents a more modern and technologically advanced approach to radiation therapy. It uses highly sophisticated imaging techniques and precise radiation delivery systems to target the tumor with remarkable accuracy. SRT allows us to administer the total required radiation dose in a much smaller number of sessions, typically ranging from just 1 to 5 high-dose treatments. By focusing the radiation beam directly on the tumor and minimizing the exposure to surrounding healthy tissues, SRT offers the potential for similar, and in some cases even better, survival times compared to finely fractionated radiation therapy. But here's where it gets really interesting. One of the most significant advantages of SRT is that it can be completed in a significantly shorter time frame, requiring fewer instances of anesthesia. This is a huge win for both the dog and the owner. Shorter treatment schedules mean less disruption to the dog's routine and reduced stress for everyone involved. Plus, fewer anesthetic events translate to lower risks and a more comfortable experience for the dog. So, with all these advantages, why isn't SRT the go-to treatment for every canine brain tumor?
Well, that's what we're here to explore today. As with any medical treatment, SRT comes with its own set of potential drawbacks and considerations. While SRT offers many benefits, there's a catch that we need to be aware of. Studies have revealed that a notable proportion of dogs undergoing SRT for intracranial meningioma experience neurological decline within the first 6 months after treatment. Specifically, research has shown that roughly a third of dogs treated with SRT may exhibit concerning neurological symptoms during this period. This decline is often attributed to what we call early delayed side effects, or EDSEs. These side effects can manifest in the weeks following treatment and are thought to be primarily caused by demyelination injury, which is damage to the protective coating of nerve fibers in the brain. These early delayed side effects can occur up to about 4 months after treatment, and the reported frequencies range as high as around 37%. This means that more than 1 in 3 dogs receiving SRT for meningioma could potentially experience these adverse effects. And here's the really sobering part. In some cases, these early delayed side effects can have severe consequences. Sadly, studies have shown that almost 10% of pets that undergo SRT for meningioma may experience a fatal outcome as a direct result of these side effects. This is a stark reminder of the potential risks associated with this treatment approach. Now, to put this into perspective, let's compare SRT to the traditional finely fractionated radiation therapy. Finely fractionated radiation therapy appears to result in a significantly lower incidence of early delayed side effects. In fact, the reported frequency of EDSEs with finely fractionated radiation therapy is only around 5% to 6%. This is a substantial difference compared to the nearly 40% rate seen in some SRT studies. How do we balance the clear benefits of SRT, such as shorter treatment times and fewer anesthetic events, with the higher risk of early delayed side effects? Is there a way to refine our SRT protocols to minimize these risks while still maintaining the advantages of this advanced treatment modality?
In light of these concerns, a recent study set out to explore a potential solution. Researchers hypothesized that by further fractionating the total radiation dose, in other words, dividing it into even smaller portions, they might be able to reduce the risk of early delayed side effects. To test this hypothesis, they designed a study using a 5-fraction SRT protocol. In this protocol, dogs received 6 gray of radiation daily over 5 consecutive days for a total dose of 30 gray. The scientists involved in the study wanted to see if this modified SRT protocol could offer a safer alternative to the more commonly used single-fraction or 3-fraction SRT approaches. The study involved a cohort of 20 dogs diagnosed with intracranial meningiomas via imaging. To be included in the study, the dogs had to be at least 6 years old. Before we dive into the results, let's take a closer look at how the researchers defined and monitored early delayed side effects. The researchers established clear criteria for identifying and classifying early delayed side effects. They defined a possible early delayed side effect as any instance of mental dullness, worsening of existing neurological signs, or the appearance of new neurological signs within 1 to 4 months after SRT. This definition was intentionally broad, encompassing a wide range of potential neurological changes that could indicate an adverse reaction to the radiation therapy. Importantly, this definition applied regardless of whether steroids were administered or MRI scans were performed. In other words, any neurological change meeting these criteria was considered a possible early delayed side effect, regardless of other factors. The researchers also established a more stringent definition for a probable early delayed side effect. This definition included all the criteria of a possible early delayed side effect, but with additional requirements. To be classified as a probable early delayed side effect, the neurological signs had to either improve with the administration of prednisolone, a commonly used steroid medication, or follow-up MRI scans had to show no other explanation for the observed signs. This stricter definition aimed to identify cases where the neurological changes were almost certainly related to the radiation therapy and not due to other underlying causes. Now, for the moment we've all been waiting for, the results. Here's the exciting part. None of the dogs in the study experienced acute radiotoxicity or clinical signs consistent with either possible or probable early delayed side effects. This is a truly remarkable finding, suggesting that the 5-fraction SRT protocol may significantly reduce the short-term risks associated with radiation therapy for canine intracranial meningiomas. But the benefits of this protocol extend beyond just safety. The researchers also found that the protocol was relatively convenient to administer. Pet owners appreciated the shorter overall treatment duration compared to traditional, finely fractionated protocols. The shorter treatment time also translated to fewer anesthetic events, which further reduces the risk of non-radiation-related adverse events. Furthermore, the veterinary team found that they were able to consistently meet the clinical dosimetry goals with this protocol in all cases. This means that they were able to deliver the prescribed dose of radiation to the tumor while minimizing exposure to surrounding healthy tissues. So what's the take-home message from all of this?
Well, the scientists involved in this study believe that this 6 gray times 5 protocol represents a promising alternative to other published protocols, particularly given the known high rates of early delayed side effects associated with some of those other approaches. There were a number of reasons why the scientists considered the 5-fraction protocol a solid alternative. First, the same protocol is often used to treat human meningiomas, which are known to be biologically similar to canine meningiomas. This suggests that the protocol has a solid scientific basis and is likely to be effective in treating these types of tumors. Second, a similar protocol has been published for canine meningiomas and has been shown to result in long survival times. This provides further evidence that this type of approach can be successful in managing these tumors. Now, before we get too carried away with the excitement, it's important to acknowledge a few key considerations and potential limitations of this study. First, it's worth noting that the diagnosis of meningioma in this study was based on MRI or magnetic resonance imaging. While MRI is an excellent tool for visualizing brain tumors, it's not always 100% accurate. In some cases, other types of tumors or inflammatory conditions can mimic the appearance of meningiomas on MRI scans. For a definitive diagnosis, histology or tissue sampling is typically required. This involves taking a small sample of the tumor and examining it under a microscope to confirm the type of cells present. The scientists also point out that they only studied presumed meningiomas, so the findings may not be directly applicable to other types of brain tumors. Different types of tumors may respond differently to radiation therapy, and the optimal treatment protocol may vary depending on the specific type of tumor. Another important consideration is the use of corticosteroids in this study. The dogs in the study were given a lengthy 4-month prednisolone taper after SRT. Prednisolone is a steroid medication that helps to manage inflammation and swelling in the brain. The extended tapering period may have contributed to the absence of early delayed side effects in this study. In conclusion, this study offers valuable insights into refining radiation therapy protocols for canine intracranial meningiomas. The 5-fraction SRT protocol appears to be a safe and well-tolerated option, minimizing the risk of early delayed side effects. However, it's critical to continue monitoring these dogs long-term to assess any late developing toxicities and to compare the efficacy of this protocol to other treatment approaches. As the scientists themselves emphasize, further research is needed to confirm these findings and to optimize SRT protocols for canine brain tumors. This includes larger studies with more diverse patient populations, as well as studies that directly compare different SRT protocols and steroid tapering regimens. That's all for today's episode of Vet NeuroJar. We hope you found this discussion informative and thought-provoking. As always, keep those minds inspired, hearts light, and tails wagging.